I want to take a moment to walk you through what to expect during an internal holistic pelvic care session so that you feel calm, informed, and truly excited about this work, okay? So this protocol was created by Tami Lynn Kent, a physical therapist and also the author of Wild Feminine. Tami developed this method to help women reconnect with the wisdom of their pelvic bowl and not just the physical muscles and how they function, but the emotional and energetic component as well. So real quick, you will hear me interchange the words pelvic bowl and pelvic floor muscles. They're the same, okay? Back on track. So during a holistic pelvic care session, we work gently inside the vaginal canal to connect with your pelvic floor muscles and the surrounding fascia. You will remain covered and in control the entire time. We move slowly. I will communicate throughout the entire session step by step, and you will know what I'm going to do before I do anything. I only work within your comfort zone, and I will always ask for consent, and you can change your mind at any time. The purpose of using internal holistic pelvic care in my work, it's to help the body release the stored tension, the emotional tension, any congestion, stuck sticky fascia, so that you are able to clear energetic blocks that may have built up in the pelvic area and womb space. Oftentimes, things that happen to you that have occurred in your life, like stress, trauma, medical interventions, or just simply years of holding, this gets congested in your pelvic bowl. Your pelvic bowl is the center of your body, and that's where everything ends up getting stored. I will use gentle touch, breath work, and awareness to help your tissue soften and for your circulation to improve and your nervous system to downregulate and feel safe again. Most women describe the experience as deeply grounding, and it's really the beginning of connecting your mind back to your body, specifically the pelvic area. Afterwards, you might feel lighter, more relaxed. You may notice that you have better posture, improved intimacy, and even a stronger sense of connection back to your body. Women love this method because it offers relief where you actually feel the problem. We're going to address the muscles and the fascia inside of the vaginal canal. And this is often, again, where we hold tension from an overactive nervous system and that unprocessed stress that we've experienced in our life. By using the combination of gentle touch paired with mindful breath, it helps your body unwind the guarding patterns that may have been there for years. As your tissues start to soften and circulation improves, energy will begin to flow more. And the pelvic mobility, your organs, the bones, they you'll notice like increased mobility, flexibility, movement, and everything starts to become restored and moving together instead of stuck and stagnant. On a deeper level, it helps you feel grounded, embodied, and confident in your feminine again. And that's why so many women say this work changes more than just their body. It changes how they feel in it. So what you can expect step by step during a holistic pelvic care session. Number one, upon arrival, we'll start by checking in. How are you feeling? Where are you at in your cycle? What does your body need today? We'll set an intention. This intention can look like, I want to soften, I want to release, I want to invite love. It's unique to you, and there's no wrong intention that you can set. Number two, next, we'll begin by grounding, taking a few deep breaths and just a quick body scan to help your system shift into safety and calm and downregulate. Number three, I will ask you for consent and verbally walk you through exactly what I plan to do so that you know what to expect, and I can make sure that you are 100% comfortable to move forward. You'll undress from the waist down, but you will stay covered with a drape the entire time, and I just want to always emphasize that you are in control the entire time, and you can pause or stop at any time. Number four, we'll do an external check-in, gently assessing your belly, your hips, your lower abdomen, just checking out the tissue and how that area may be holding tension in your womb space. Number 5, we'll transition into the internal assessment, where I will gently use one gloved finger with lubricant and clear communication the entire time. And this is when I will check the pelvic floor muscles using the pelvic clock map, moving around from 1 o'clock all the way around to 12 o'clock, feeling for areas that are underactive, tight, or tender, checking in with what you may be feeling as well and comparing. Number 6, through sustained gentle pressure and guided breathing, I'm going to invite your tissues to soften with the purpose of release and repatterning. You might hear me say cues like inhale to widen, exhale to melt, for example. It's never meant to be forceful. It's meant to be slow, intentional, and deeply restorative. We will take our time. I don't expect you to do anything except be and practice receiving and being in your feminine flow. Number 7, we'll check how your muscles respond after release and guide a few closing breaths to help your body integrate the changes. Number 8, we'll begin closing out the session and finally end with you taking time to journal and reflect on anything that may have came up. Common sensations that are totally normal is you might notice gentle pressure, some warmth, or the sense of like stretching in your pelvic bowl area. Some women experience emotional release. This can look like sighs, tears, a little bit of shaking, deep exhales, this deep internal, like, oh, I need to move my body, I don't want to lay here. And that's fine. You do not have to lay there like still. Like, I want you to listen to your body. I'm your guide. You are your expert of your own body. I'm just here to guide you. So yeah, my goal is for you to, after the session, to have an emotional release. Feel more connected to your body. I want you to feel a sense of lightness, spaciousness, and peace after the session. And just rest, okay? If you've been craving a deeper connection to your body, Internal Holistic Pelvic Care is a beautiful place to start. And it's not a one-time thing. It is a practice, okay? You'll start with me. You can also do this solo, and we will go through that as well. And this is where physical healing meets emotional release and freedom and reconnection. And it's truly a sacred experience for your body and tapping back into your feminine.